Hello everyone, I'm back. I'm Dr. Neha Choudhary, a consultant breast surgeon at Narayana Health, Kolkata. And today I would like to talk about life after breast cancer treatment. So, the treatment of breast cancer is progressing tremendously. We are having so many patients who are able to complete their treatment and live a normal lifespan. So, they are recovering fully. But a lot of them, they do have this difficulty in returning back to their normal life. There's a lot of trauma, stigma, lot of post-cancer treatment symptoms, lot of side effects that they deal with. And the question stays that how do they manage these symptoms and still be able to live a fulfilling and a happy life. So let us come one by one about what are the possible problems you might face once you have breast cancer and you get the treatment done. Let's start with the most basic one. A lot of women, once they are having breast cancer surgery, they are having to get the breast removed, or something that we call mastectomy. So here I would also like to point out that not all breast cancer surgeries have to be mastectomy. The option of breast conservation surgery or saving the breast and removing the tumor only is a valid option. In fact, it is the standard of care for the patients who are a candidate for it. It is completely safe and it should be opted for whenever your doctor gives you that option. However, if for some reason you have to undergo mastectomy, it is not something that you have to be totally hopeless about. There are a lot of options today where you can reconstruct the breasts in various ways. We can do some kind of a plastic surgery to reconstruct the breast. So what are the options? We can reconstruct using implants or your own body tissue, which is called as autologous breast reconstruction. It can be done at the same sitting, that it is the time of your mastectomy surgery, or even later, maybe a year later after you finish your entire treatment, you can still go to one of the surgeons, plastic surgeons, and ask them for a reconstructive surgery. So this can be managed. If you're having body image issues, if you're having any kind of difficulty accepting the fact that I am not happy with the mastectomy, you can always get a reconstruction later. Now the second and a very important and significant side effect is lymphedema. So whenever a lady has to get axillary surgery, or especially a complete axillary dissection for during a breast cancer surgery, one of the important side effects is lymphedema or swelling of hands, heaviness of hands. This usually happens because we are removing lymph nodes from your armpit, and the function of this lymph nodes is to drain fluid from your hand. And since that function is disrupted, the fluid accumulates, you start getting heavy hands and swelling in hand. So how do we avoid it? First of all, we try to prevent it at its niche. We try to avoid doing an axillary clearance. So whenever we have a clinically node negative case, we offer the lady sentinel lymph node biopsy, and whenever that can be offered, axillary clearance should be avoided. However, if for some reason you do get an axillary clearance, we do tell all the women to be very careful. There are a lot of preventive measures to avoid lymphedema. One of them is to avoid repeated trauma to your hand, any kind of burning, cutting, tight clothes, tight bangles, we avoid them. Regular physiotherapy also decreases your chances of lymphedema. Regular exercise, massage techniques. So there are a lot of different ways your physiotherapist will be able to tell you in detail. The third thing is chemotherapy and hair fall related to chemotherapy. That is a huge fear among women. A lot of women do not want to take chemotherapy just because of the fear of hair fall. You need to understand this is temporary. The hair that falls during chemotherapy always comes back, and within 3 months of stopping chemotherapy, the hair starts growing back. However, if it is affecting you so much, there are other options. There is something which is known as scalp cooling. If you do that, if you take that during your chemotherapy, the hair fall is much lesser, and also the regrowth of hair is much faster. Apart from that, you can opt for wigs, bandanas, and lot of other options are there to not make your hair fall so visible to the public. Now coming to other options like younger women who have not completed their family and who want to have children in future. So whenever you are facing such a situation, do talk to your doctor right at the start, at the beginning of treatment, before you get your surgery or your chemotherapy, that I want to have children in future, and there are options of fertility preservation which can be offered, and later on you can successfully have children. So do explore that option also. Apart from that, there's a lot of stigma and a lot of post-traumatic feeling after breast cancer treatment. If you do feel depressed, if there is a fear of recurrence in your mind, do get counseling. There are a lot of cancer specialist counselors. Meet them, they'll talk to you. They routinely handle such things. The first thing is to accept it, understand that you're going through it, and go and talk and take help. Apart from that, saying this, I have seen that most women handle breast cancer really well. They are fighters, they are warriors, and a big salute to all of them, and good luck coming back to your regular life. Thank you.